Patella tendinitis is also known as jumper's knee, particularly happens in people who have overstrained their patella tendon. So if you look at this anatomy here, the patella tendon is basically a tendon which is between the kneecap and the tibia, and this gets pretty much activated when we try to move the knee in flexion and we try to extend the knee. So people who do a lot of running, a lot of jumping, who are active in sports which requires a lot of movement and force in the region of the knee, they may tend to have an issue of overuse, and this can result in some degree of tendinitis. If the condition is chronic, then it is called tendinosis. This is also classically known as a jumper's knee. So management of this problem is most of the time conservative, which means that at the state of inflammation, you'll be given some amount of anti-inflammatory medications to reduce the inflammation. Alongside, of course, you have to rest to prevent further injury or stress to the tendon. Physiotherapy again helps a great deal because it helps to strengthen the quadriceps muscles, which will then offload the amount of strain on the patella tendon. Many people have this issue because there is coexisting tightness of the quadriceps and hamstrings, which then causes excessive strain on the patella tendon, and hence when they do a particular activity, especially when it's overdone, then it strains this area. Hence, it then gets inflamed and you will have pain resulting from the inflammation. Therefore, it is very important to do regular physio to strengthen and to increase your flexibility of your quadriceps and your hamstrings, especially if you are intending to go into a long run or you intend to get involved into a sporting activity which involves a lot of jumping. Therefore, be always on the guard when you are intending to go into some kind of activity. Sometimes you may use a particular knee guard or a brace to support the knee so that when you are involved in that particular activity, the strain on the patella tendon is reduced, and hence the incidence of injuring the tendon or ending up with patella tendinitis or jumper's knee becomes less likely. Therefore, seek an early diagnosis if you have persistent pain, and most of the time with conservative approach to the problem in a very holistic way, the issue can be resolved. Thank you.